Mm,
Yes.
So welcome everybody to this info session on the graduate certificate in Spanish for health professions at Rutgers-Camden. I am Ana Laguna and Eveling Hondros. We are the coordinator, Eveling, and the director of this program. And we are here to present to you an innovative online program that empowers healthcare providers, public health professionals, and medical students to make a deeper impact. So we have a brief presentation really to give you some details about the program. Um, yes, thank you. Thank you very much. So you can go to our web page, which is the second slide, right? Yeah, I will be sharing the screen and I'm sorry because
That's
for some
okay.
reason, can you see my screen now?
Yes, we can see
Okay.
your screen. I can see the presentation, but probably with slideshow is a little better if possible.
Yes.
Yes. Okay.
Mm-hmm.
And in the second slide, actually, you can see this is where our program lives. You can see there's the apply link there and some other information about the admission requirements and such that we're going to cover in a second. So we can go to the third slide. Yes. So, as one scholar put it here, all complaints leveled against modern healthcare seem to point in the same direction, that medicine is not humane enough. So, our program was created to address exactly this gap by preparing professionals who can unite clinical competence with linguistic and cultural understanding. So, with us, students don't only learn another language. Our training teaches them, I would say, a model of care that centers human dignity, whole person treatment, cultural respectful communication, and a patient-centered approach. And if we can move on, these are not just nice things to have, right? These are not only soft skills, these are actually professional competences recognized by the most important bodies and professional associations in the planet. Here, we just gave you two examples, but we have a long list that we have studied actually to make sure that our training really matches their expectations. So with us, you will be working on your professional competence through and through. May we continue? We want to tell you a little bit about how this program came to be. It was an undergraduate program that evolved into this full-fledged now graduate certification, and it has a variety of components. Profe Hondros, you want to continue?
Thank you. So our undergrad and graduate certificate encompass five different components that we think are very essential for the student in the healthcare settings. We have the civic learning experience in the community, which the student engage and then apply the theory that they learn in our courses and apply and use it with the community. For example, we partner with the Croc Center. We also do it with the Hispanic Family Center and also with the Rowan Cooper Medical School. All those partners organization are from South Jersey because that's the area that we cover because we are in Camden. So we want the student also to be in Camden as a student, but also to be a leadership and also to work with the community surround the university. We also have international field experience as we are excited this year. We have Dr. Laguna who got the Fulbright in Finland. So we are so excited because we are collaborating with Finland University. Dr. Laguna is doing amazing, it's going to be such amazing research over there in collaboration when the students also will learn about the global health community in here in the United States, but also global. That way they can have the perspective and can have the opportunity to do some comparisons of what we are having here and how other community experience the healthcare.
Mhm.
We have also student organizations. The students are part of different organizations when they are leaders also, and they do research. They do different activity when they participated in presenting their research. Also, they provide service to the community as organizations. We have hombres, we have mujeres that also are Latino students who are the lead of this organization, and also we have the biology club, and we have also a community interpreter certificate, which we offer also for the graduate student. We offer a selective or optional, which is very important for us to provide this course, because especially when English is your second language, but your parents are coming from a different background, we hear the story about the students say, "Oh, my mom, my dad doesn't speak the language, so I go to the doctor with them, and I am the one who interpreted everything." So we uh, teach the students, show the students the ethic that they have to follow, the standard also, because they cannot be interpreter because they don't have the appropriate standard and certifications that they need. So I don't know if Dr. Laguna want to add something.
That's perfect. Maybe the next slide we can
Yeah.
tell them also. So yeah, we've been incredibly honored to have been recognized by a number of different bodies, institutions, national and international organizations. Like Profe Hondros was saying, or Eveling, I am gonna be leaving for Finland in a couple of weeks, and we are bringing this program there. It's one of the best educational systems in the world, so it is saying something. But we're incredibly excited actually to share, to have these partnerships with institutions from all over the world. Profe Andres was talking about, maybe we can go to the next slide. We're just gonna touch briefly on the application materials. Profe Andres, you wanna talk about this?
So when you want to apply for the certificate, we're going to share also this presentation and also the link. So you will have the link. It will be very easy. So you have to click on the link. When you click on the link, you will have the information about our certificate. So you have the program overview that is 12 credit required. You can be a full-time or part-time student. That depends of your flexibility on how flexible is your job to come in here and do part-time or full-time. We were thinking when we were creating the program, we were talking about what is the more flexible way to support the student who are full-time students. So Dr. Laguna come with the idea of doing online because they offer more flexibility for those professionals in the field to engage in registering our course and complete the certificate. So it's online. You can complete it in 2 or 4 semesters. So the 2 or 4 semester is just to give you an idea the time frame that you can complete it, because everyone's working in different pathways and also a pace. So we just 2 and 4 semester is just like to give you a time frame.
Exactly. And so what would you be doing these 2 or 4 semesters? So these are, and you can find them again online, but these are our offerings, and these will be our the courses that you will be choosing from to get to those 12 credits, right? So we have courses like Spanish proficiency for health professions, right? Is a very advanced review of not only the clinical lexicon and the minimum grammar that you would use actually to talk about diseases, but in this final review of the Spanish proficiency, we actually practice not only the lexicon per se, but also the cultural elements that surround it. For example, you will not only learn or review how to speak about COVID or flu, but also about vaccine hesitancy, for example, in certain communities. So we really do these diseases in context, right? The humanized or the human side of the disease. Health and wellness in Latinx communities. Profe Hondros teaches that class. Yes.
Thank you. So health and wellness in the Latinx X community, we the core focus on the Latino community. So what we learn is we start with presenting to the student if the health to get a service or for the Latino community to get a healthcare provider is a right or no, and how they can access that if they have that information. So we learn about the Latino community having access, the challenge that they face is to get access to the healthcare in here in the United States. Also the barriers like a language, also and preventive access for those Latino community and what is the impact that they have in their health. So we also learn about the some Latino practice as such as the food that they eat and if they have any knowledge of what kind of food they can eat to be healthy, why they cannot be healthy because they don't have the resources. When we're talking about resources, we're talking about money. If they don't have the money or if they don't have the opportunity to get the products that they need to be healthy. So we focus on the Latino community and also in the practice that they have as a community and how that affect them.
Exactly. Then humanism in medicine, we examine how the humanistic elements of clinical training were stripped from the profession at the turn of the century and the consequences of that shift. We review and incorporate the best practices in the medical industry that are trying to really solve that dislocation or that fragmentation, and we introduced a humanized approach through we evaluate how reintroducing that humanized approach really contributes not only an improvement of patient satisfaction, but also provider wellness, and how it contributes also to system level reform, right? It's been a very successful class, and we're incredibly proud of that one. Cultural literacy in healthcare, we first have a very thorough discussion on what cultural literacy is. If it's, for example, an expectation, a mandate, just wishful condition, right, to have before treatment, we really discuss what it is. And then we see also how research has shown that culturally informed practice, clinical practice, improves not only health outcomes, but also the emotional presence, the empathy, and the availability of health professionals to form meaningful connections and with their patients. So that's what we do in those classes. Those are the core classes that we have. You will be choosing from them, but then also you will be able to we will be able to give you credit if you are part of a field experience in Latin America or in a Spanish-speaking country, or if you have a particular kind of internship, it would have to be approved by us, but we can certainly give you credit for that too. And then Profe Hondros offers this community interpreter certification, and this is a little strange, not strange, but it really begs further explanation. We have a certificate of 12 credits, but within the courses that we offer, there is this one for 637 that offers another accreditation. This is an accreditation as a medical community interpreter, okay? And it's not an official interpreter, it's a medical community interpreter. That means that in a hospital, in a clinical setting, you will be able to work as a medical interpreter for your community. And Profe Andres, you want to say something else about this class?
Yeah, so for the course, we just hear the information about the course. So we also ask the students to take a OPI test that is oral proficiency. So the student has to be proficiency in Spanish. And when they take the test, that is I believe another, it's the same test that some student who want to be a teachers or in the education field they have to take if they want to teach Spanish. So it's a oral proficiency. They You have to pay for that. You make a call. So the person will start talking to you, asking questions, and based on that conversations, they will give you a rank, which we need to see the way we can provide you with the certificate. Because based on that, we will say, okay, you can be a community interpreter, and we specify the thing that you can do based on the result of the test.
That's exactly right. So exactly. In that course, you're going to learn a lot about the ethical mandates, the ethical understanding of interpretation, right? Especially medical interpretation. What often happens is that one walks into a meeting of this sort between a doctor and a family, and somebody from the family may tell you, please don't translate this, don't interpret this, right? What are you supposed to do? So we tell you, right, what are the ethical mandates? In that case and many others, you will have a very clear understanding of, the professional guidelines for every situation of that nature. But also, this is a course that is not, we're going to do a lot of practice, but we're going to assess your proficiency through the national exam that Profe Hondros was talking about. It's an OPI, it's a national proficiency test where you are going to get a grade, and that grade should tell everybody if you are really at the level of being an interpreter or just a bilingual worker or something else. Okay, so this is an optional accreditation. Maybe you take an extra Spanish class and you say, my Spanish is almost there, but I need to take another one before I take this 637. Well, we're here, for you whenever you're ready. And it is a class that really can offer you, again, an additional accreditation, and you can end up with 2 instead of 1, but it is optional.
And also to add a little more about the
Yes.
requirements, we keep receiving emails from the students saying, how about if I don't have the level of the knowledge of Spanish to be in a graduate course? So we were discussing with Dr. Laguna, and we were talking about to provide the student the solution if you feel like you don't have the knowledge of the background that you need to be in a graduate level course. So you can always take undergrad courses, right, Dr. Laguna?
Absolutely. Yes. Yes. They will not count those. We will meet you where you are. If you don't know Spanish, or you took Spanish a long time ago, but you're not ready to step into a graduate certificate, we have other proficiency building courses that you can take. We can start from 101 pretty much, which is called 103, but we can start from 101, or we can start with a review. We're going to start with something that is more intense, less intense, but we can really get you there, get you to a proficiency where you at the graduate level, when you're going to start with this Spanish proficiency for health professions that is already pretty advanced. Okay, absolutely. Thank you,
And
Profe.
that will not be
Very important
counted
point.
toward the graduate courses, right? That will be just for them to,
Correct.
okay.
Yes. Those don't count, obviously, for as part of these 12 credits because they don't have the graduate level. They're just proficiency building courses that are there to support you, right? But a lot of people have asked us about them. And, it's important to know that, we're not asking you to make this huge jump. If your proficiency is out there, that we will work with you to make sure that you get where you need to be to start this professional certification. And if you're ready, actually, these are the admission requirements that we have. You will need 2 letters of recommendation. They have to be professional. They don't have to be educational, meaning it could be from your supervisor, right? It could be from a very significant colleague. It could be from a mentor, a professional mentor. It doesn't have to be from your advisor when you were in college or when you were in medical school or nursing school. So that's what counts as 2 letters of recommendation. A personal statement. It doesn't have to be in Spanish. It could be obviously in English, no problem. If you want to do it in both languages, that's fine too. And then a cover letter, just brief declaration of why you want to do this, and the CV. Profe Hondros, have I forgotten something?
No, I think so you covered everything. Thank you. And then the last information that we have is way that you can contact us. We have the program contact here, Dr. Laguna, the email, and also you have me, Eveling Hondros, the coordinator, and we also have Eric Udugo, who is the assistant dean from the graduate school in Camden. So you can contact us either, and then we can provide you with the answer of any question that you may have.
Yes. Thank you so much, Profe Hondros. So that's the end of our presentation. I'm not sure if there's questions. If not, we will be answering on an individual basis as we receive them. Well, thank you very much for your attention and for being here with us today.
Thank you.